another episode of Next Medical Affairs, and I really wanted this interview for a while since I admire the work of our today's guest. Welcome, Toni Vidal. How are you doing?
I'm very good. How are you, Dario?
I'm likewise good, so looking forward to today's conversation. We see that there is a lot of ongoing things and changes happening in space of medical affairs. We witness that on the daily basis. And I remember your statements about the importance of coaching, of the constant development of MSLs and the medical affairs teams. So I would like to start with my first question in that direction, which is, did we actually forget about aligning people and tech, since we only speak about tech like omnichannel and capabilities instead of coaching and aligning the human side of business?
Yeah. So look, I mean, we are always super excited with the new wave of technology, right? I mean, so if you remember 20 years ago, everybody wants to have their own website, everybody want to have their own page to share content, and it was the hype. It was all about the digital content, just like pushing for digital content. And then very soon we realized that it was pretty useless if this was not combined with a human element. Like, I mean, it's the website, it was just a link with a human behind the web. And I think eventually we will land in a very similar territory with all this AI and omnichannel, etc. Is how we combined the technology with the human element. Even if we are becoming, all of us, we are becoming a little bit millennial in the aspect that we are all very dependent on all these evil device that we have in our pockets, and we are paying less and less attention to what's going on. We have much more difficulties to stay quiet and listening and reflecting. We are all becoming a little bit of ADHD in our own way of working. But I think eventually we'll have to land in a place where the human and the machine work together. I just read a paper about different ways of interacting with AI. So I think you have the centaurs and you have the cyborgs. So the centaurs, they have a very clear cut between what the AI is doing and what the human being is doing, and they pick the best of the two worlds. So they are very efficient because they are trying to basically, where creativity is important or emotions are important, the human is the one leading the way. And when it has to do more with repetition or speed, or just bringing many sources of data and integrating them, then the machine does it. But you have this clear cut. So the centers does very well because they are very efficient. The cyborgs, which are kind of mixed between the machine and the human, that sometimes they get lost in okay, who is doing what. So you want to write a paper using AI, and then you do a first draft, and then the machines correct it, and then you change it again, and you send it again to AI, and eventually you lose a lot of time just trying to figure out what is best. So I think eventually we will learn to use this in a more efficient way, and then how to interact this with a human being in the other side, because this is I'm so far I'm only speaking on how you use the technology, but also how you interact with other human beings through technology. So all these chatbots, etc., they are getting better and better and better. So I think we are learning to feel more comfortable speaking with a machine, and knowing, but always knowing who is behind the machine, who is behind the chatbot, what are they trying to tell me, even using this AI or this platform, but what is the trying to connect with a human being behind the technology. And I think that's what is eventually it can be the benefit of this, if we use this as a tool and not at the end in itself. Sometimes we get so in love with the technology that we find that this is it. I mean, let's put money here, let's put resources, let's put energy on AI, or let's put money in websites, because this is, if you are not there, you don't exist. If you don't have a website 20 years ago, you didn't exist. If you don't have a chat GPT initiative right now, you become like a 20th century guy. I think that's a mistake. If we take this like an end or a goal in itself, you need to start with what is the job to be done, and then how the tool like fits in this job to be done. And at the end, our brain, our social system is based in hundreds of thousands of years of evolution. And at this moment, we are in diapers, how we are gonna use this. So the human element, it cannot be like something we will think at the end. It needs to start from there, and let's see where we land. Yeah, that's my position right now.
Yeah, absolutely. So evolution it is again, right? Which leads me to the next question, and this is how actually, let's speak again about the teams. So how actually do you align your local medical affairs teams with a global framework and strategy?
Global, sometimes we talk about global like they are like aliens, right? So they are somewhere lost in a corporate building. Global is, as I always saw this function, they are our strategists, and they are the guys that are able to visualize what's going to happen in the market or what's going to happen in the environment in the next 5-10 years. They don't have the pressure. They shouldn't have the pressure of the next quarter or then even the next year. They are allowed to think longer, and they are allowed to think bigger. So I think the beauty of working in global, at least that was my experience when I worked in global some years ago, is that you can dream, you can predict what's going to happen, how the competitors will interact with you, how the healthcare systems will evolve in time. And that gives you the opportunity to visualize also how your organization is going to behave in that new scenario. So then the countries are in the other extreme. The countries, they have the clinician, the patient in front of them every 24 hours. So they need to react in real time. If they have a request about a research collaboration or a patient association with a certain need, you need to react in hours, not in years. And that creates this healthy tension between the thinkers and the doers. It's not that the countries don't think. Don't get me wrong, but the countries think in a very short-term loop, and that's great, because that's agility to think about tomorrow is what we need to be customer focused, customer centric. And then you have in the middle the region, which I always define like a friction zone, right? It's like a California or Japan. They are very, very sensitive to earthquake and tsunamis, and because we are dealing with that tension between the future and the present. So I think the region has a beautiful place to connect the dots between the tomorrow and the today. And these big slide decks and beautiful slide decks coming from, I'm not going to say any consultancy brand, but from these big thinkers that what's going to happen in the next 5, let's say, no, don't say it. But these big thinkers that they are understanding, okay, how the market will evolve. I think the region has the duty and the mandate to make those two worlds work together. So our job is to make that visionary guys to land in a place where the countries can operate and still organize the next quarter or the next year in the right direction. So that, I mean, this is a little bit like navigating, right? So if you have your boat and you want to go a certain direction, maybe the day-to-day is pushing you in a certain direction, but you need to have a clear end where you want to land. So if technology is going to be the future, or in the future, I don't know, 90% of the doctors will use the digital channel to get informed. Maybe that's the destination, but until you get there, you have a human being in front of you calling to your phone, or say, come to a face-to-face visit. So you need to navigate in that direction, but at the same time react. So the region is the layer that make this long-term vision and reality fits, and the other way around. And I think the region also helps to bring insight from the countries to a point that the global world can incorporate those insights to the future vision. So that's more or less what I do in my daily life, is to combine the best of the two worlds, with sometimes a little bit schizophrenic, I have to admit, because I can be speaking in the morning about the phase 2 program that will happen in 2030, but 20 minutes later we are discussing about the KPIs in terms of face-to-face visits, or and I think that's the beauty of a regional role.
Absolutely. Last question for today's podcast is actually medical first the perfect playground for developing omnichannel, the most hyped word nowadays in pharma, or one of the most hyped words? And I'm actually asking that because medical actually enjoys in another data quality compared to commercial, right? Because somehow the science articulation is finer, the visit type is finer and different. So is that really the perfect playground for omnichannel compared to commercial? What do you think?
I mean, long story short, the answer probably is yes. Omnichannel by definition is not easily regulated. So you need to be spontaneous, is real time. You cannot control what is said outside. So by omnichannel, we mean the physical world and the digital world, and within digital, you have what you find in your laptop, but also what you have in your phone, and what you have in other platforms, and how you integrate all these different channels in one integrated message, or integrated relationship with the clinician, with the patients. So I don't think there's any other place than medical to play that game. Medical is more flexible because first of all, we can react to things that commercial cannot, because they cannot jump into things that are not within the label. So when we are having a conversation from a medic to a medic, so pharma medic with a non-pharma medic, or a practitioner, the conversation gets much more spontaneous, and we can interact at a different level. So omnichannel and medical goes hand by hand. That maybe another element is that probably we as big pharma corporation, we need to be much more realistic about what omnichannel means. I don't think we can own an omnichannel strategy. Omnichannel is, by definition, you do it with the external world. The external world own 90% of the, or 99.9% of the omnichannel content. You are just a drop in the ocean in terms of communication, right? So for instance, ESMO is going to be next week, or maybe I think starting on Friday. The volume of information that is generated in ESMO is massive. It's massive. Maybe I don't know. I don't have the numbers, but maybe it's 1,000 Twitter or 1,000 LinkedIn posts per day. Even with your best and strategy or a lot of resources, you can be just maybe 1% of that volume with your own company post, or your own Twitter post, or LinkedIn post. This is just 1% of the whole volume of I wouldn't say noise, but the whole volume of content that is generated in an event like that. So if you want to play the omnichannel game, you need to build that with the other 99.9% of the content and being another stakeholder in that ecosystem of information, content, energy. And you only do that in full collaboration with academia, with the big digital opinion leaders in the ecosystem. So the days when you have your beautiful slide deck with these are my 10 messages that I need to get across in my symposia, being honest, those days are over.
That's gone, yeah.
First of all, you don't build the 10 messages list by yourself, because that's, I think, is useless. You build those 10 messages with the community, with the scientific community, and say, okay, what is relevant for the practitioners, for the healthcare system in the next year? These are the 10 topics that are important. And then you have your level of contribution as the owner of the molecule. Many times you have your level of contribution within those 10 messages, but the rest is managed, is owned, is driven by the community. And you help to get the right message at the right time, trying to avoid confusion when the things get, or fake or not real, or they are not really stating the truth. Our job is to correct it, but we are just another stakeholder in that ecosystem of noise. And in this world, I mean, maybe I was very naive, but when I was 20 years ago, when the internet started, and I had the feeling that it was impossible to be misinformed anymore. I mean, everything was there. So if you wanted to know something, everything was there. The paradox now, 20 years later, is that there are so many sources of information that our job is to find the truth within so much content. And I think our job as a pharma company probably is to be curators of what is true and what is wrong, what is noise and what is signal, and just to help in that common job to be done, which is to put out there what is best for patients, healthcare systems, communities.
Absolutely.
And try to delete or to criticize those things that are just fake news or not real. So that and the first assumption for doing that job is that you are also neutral, that you are also credible, that you are also trusted. If you come with very clear bias because you have this commercial bias, you will be automatically neglected. So I think you need to be trusted, you need to be credible, you need to be reliable, and then is when you can be another stakeholder trying to state the truth in the media out there.
Yeah, fantastic. Okay, Tony. So I really enjoyed in today's conversation some very interesting insights. Looking forward also meeting you in May in Dubrovnik, since you speak at our upcoming flagship event next. Really enjoyed quite a bit, and take very good care.
Very good. See you there. First time in Croatia, so I will enjoy it.
Fantastic. Thank you, Tony.
Thank you.